Hi, this is Lindsay Lerdahl with Training and Development, and I am here to talk to you guys about C. diff and preventing C. diff infections. A few months ago, we sent out a C. diff pretest, and based on those results, we decided that we needed to do a little bit more education with our staff. 123 staff members completed that test. It was 10 questions. So, what do you think the score was? Our average score was 63%. We're going to start with a video here. This is the story of Alicia Cole's patient story. She did not get a C. diff infection, but she did get a hospital-acquired infection, and so she's just here to share her story with us.
Hi, I'm Alicia Cole. I'm an actress. I live in Los Angeles, California, and I've been an actress, been in the Screen Actors Guild for 19 years. In 2006, I found out that I had fibroids. So I thought, okay, well, if I get these fibroids taken out in August, I'll be healed, I'll be ready for the start of the television season. I was supposed to be in the hospital 2 days in and out. I had the surgery, but I never got better. It just spiraled from there. My breathing started becoming very labored, and my heart rate just went crazy. My abdomen was flaming red, and it was hard like cement, and it was on fire. My mother saw a black dot, like you took a Sharpie marker and just gently went like that. It took the doctor about an hour and a half to get back to the hospital. And he said, oh my, okay, now we need to be concerned. The black dot was like the size of a quarter. It looked like my skin had melted. He looks at my mother and he says, Mrs. Cole, are you squeamish? And my mother said, no. And he said, good, because I need you. I was terrified to ask my mother to assist him and not wait and take me back to the operating room in a sterile, clean environment, to take a tray with gauze and put it in the window seal overnight, and then take that same tray, lay it across my legs, and start pulling gauze out of an already open box. And they basically use their hands to pull open my incision. I've never felt that kind of pain ever in my life. Ever. The infection was spreading about an inch every hour on the surface, so even more underneath. So the infectious disease specialist should have been there that night, but she didn't come until the next afternoon. No one really paid attention to the signs and symptoms that I had. In that hospital, starting from the top down, there was a lack of consideration for the patient. It wasn't until after that, a few days, that the doctors verbally told my parents what I had. Sepsis, Pseudomonas, VRE, MRSA, and necrotizing fasciitis, flesh-eating disease. It was an indication of a total system breakdown. I was in a prominent, beautiful facility. I did my homework. I did what an engaged patient is supposed to do. I was proactive. Like my 2-day hospital stay for routine fibroid surgery went from 2 days to 2 months in the hospital, a month in ICU, 9 blood transfusions, 6 additional surgeries, almost having my left leg amputated. I had a year and about 2 months of twice-a-day home health care nurses. I had an open abdomen for 3 years that would drain. Physical therapy off and on for at least 4 years. Doctor's appointments every week for the last 7 years. And over $2 million in medical bills. I used to have a lot of faith in the system. When I see what's happening in healthcare and people who It's just a job. And coming to take care of a woman who's missing her abdomen, and I don't bother to read her chart before I get there. Or I don't bother to wash my hands. That kind of thing hits me at my core because it's not how I was raised or who I am. We believe in honor and loyalty and truth and standing for something, no matter what the cost. My life is completely different. It's, I was a cheerleader, volleyball, basketball, softball, ran track, bowling, you name it. So that's real hard. I had the most amazing support system going through this. It's what saved me. Literally what saved me. There are so many patients who are by themselves, and that's why it's so important to me to speak out, to advocate, to give back. And I'm very, very proud to have been a part of the two laws for public reporting of hospital-acquired infection rates in the state of California. Our hospitals are scary places. Our healthcare system is broken, but there is hope. And that hope is patience, patient engagement, patient involvement. Albert Einstein says you cannot fix a problem with the same mindset that created it. Patients bring a fresh perspective. We are the secret weapon, the magic bullet. Patience will change healthcare.
C. diff is a spore-forming bacteria that causes enterocolitis. Some of the symptoms are watery diarrhea, abdominal pain and cramping, dehydration, weight loss, fever, and elevated white count. C. diff spores can live on surfaces for up to 5 months. Spores can be reactivated then once they are introduced to the GI tract via fecal-oral route. Alcohol-based hand sanitizers do not kill C. diff spores. You must use soap and water. Although soap and water does not kill the spores either, but using your alcohol-based hand sanitizer is like having greasy hands and using cold water without soap to wash your hands. It just kind of smears it around. So with the soap and water, you are lifting them up off of your surface of your hands and then washing them down the drain. You must use bleach for cleaning. In fact, alcohol-based cleaners such as Quat, or Virex, or PDI wipe cleaners can make spores more resilient. They get a harder shell around the outside of it, and it just makes it more resilient and harder to kill. There is a specific criteria for testing for C. diff, and we have a policy of that right here in our CIRMAC policy stat. Let me pull that up for you real quick. Alright, here is our policy stat policy. It's for both Fort Madison and West Burlington campus, and it is our C. diff testing protocol. There are certain things, reasons why we would not want to test a patient for C. diff. If a patient has been positive for a C. diff in the last 14 days, if you've had a negative C. diff in the last 7 days, if a patient has received a laxative within the last 48 hours, if a patient is less than 2 years old, or if a patient has less than 3 liquid stools in a 24-hour period. If your patient comes in complaining of diarrhea and your doctor orders C. diff, and then they have not had a loose stool within 24 hours, please get an order to discontinue that C. diff specimen collection, because most likely they do not have C. diff. If your doctor does order a C. diff test on a patient who has had a laxative, this is the screen that you're going to get when you go to file that order, and it is a hard stop, and it makes you cancel that order. If your provider really, really wants to order it, he must call the lab. He or she must call the lab to get the pathologist to place that order. If your patient is positive for C. diff, you need to make sure you notify the provider. Make sure the patient is in enteric pathogen isolation. That means the brown tan sign needs to be hung outside the door. We use the brown and tan sign and make sure that it's the enteric pathogen ones. So staff and ancillary staff know that they need to wash their hands with soap and water. Do not use hand gel, and then they also need to be cleaning with bleach. Treat C. diff per provider order, and you can remove the patient from isolation after patient is 48 hours without a loose stool. Remember, C. diff spores can live on the surface for up to 5 months, so we want to make sure that we are getting the patient out of that room and cleaning it per protocol. And then also studies have shown that C. diff infections, hospital-acquired C. diff infections, it trends within like patients being in the same room as another positive C. diff patient. So don't be gross, wash your hands. Have a good day, guys.